Let me show you a footage of how you, the private sector, COVID-19 fund, you did your distribution, and let's see if that can be used even as a standard. Let's watch this, and I'll come to Dr. Amosi shortly. So for those of you who are listening on radio, you didn't have the benefit. Those of you on television, you can see that the people, they've masked up. They run into each other, and those who are about to distribute the food are the ones trying to help them to stretch their hands and use that as a measure to social distance. And it looks almost practically impossible. They are in a queue, and each person is touching the other. You've seen that. What do you say?
Yeah, I mean, so this is what I said earlier, that I was part of it, and even at that level, we realized that it was problematic. You can see what we were trying to do. We were telling them that you stretch your hands and make sure that you have that same distance between yourself and the person. So if this is your hands, let's say this.
Before they do that, this is their sardine packaging kind of queues.
No, that's
if somebody has it, they would have, somehow.
This is exactly what I said, that we found that even problematic, because to start off with, before they even get into the queues, they will actually be masked up before the food arrives. Mm-hmm. One or two of the instances, I got to the scene before the food arrived. Mm-hmm. They knew the food was coming, so they had already masked up. You tried to talk to them, we used the community leaders and what have you, but especially when they see the food, things get out of hand. And we were doing our best, as you could see, to try and organize them in a way that social distancing will be observed. And it was pretty hectic. But I'm sure when we go to the next footage, where the general one is, you see that it's even more chaotic than that.
Oh, it's more chaotic, yes.
I'm not saying that this is the best, no. Okay. But all I'm saying is that we found it difficult even at our level.
Okay. Yes, Doc, what do you have to say about this?
What I would say is this is a typical nature of Ghanaians.
I think you've gone to the second one.
It is a typical.
Now we are looking at what the government, this is the government-sponsored one. Okay, so no queues, and this is chaos. This is chaotic. Yes, food at people. And the food is being thrown. It's being thrown at the people as they mass up. You can imagine some people will even fall on others and so on and so forth. Yeah, so yes, Dr. Isiasa, what do you say about this?
We've discussed it. And we've charged the Minister for Gender and Social Welfare to take care of it. You see, what you can do.
No, but see the way they are being throwing. How are you setting that someone is not taking double or even multiple?
It's completely wrong. Like Samson, it's completely wrong. It's not acceptable. If you go there and there's a chaotic situation there, if I will drive away and then come back again. Or we should use the community leaders. We should use the assemblymen, we should use the chiefs, and give them how many people do you have in this area. Then you tell you give it to them, and then you call them to come maybe to the house one after the other and pick it. But I also appeal to Ghanaians that, you see, this is a food ration that the government is giving through the faith base and also through NADMO and then the Ministry of Gender.
Okay, so if I may plead with the guys, stop showing it. It's not
horrible.
Don't show it again.
It's horrible. I think this is not the best way to organize anything. And I believe that, as we discussed at one of our meetings, the minister, NADMO, the MCs and DCs and Metropolitan Chief Executive should take a very good look at this. Look at the footage, which is very bad, and they organize themselves very well. There are community leaders in every community. You can ask them how many people, and they gives you the number. The food can be given to the community leaders and call them one by one to come and pick it. And I also appeal to every Ghanaian that when you are going for these rations, don't take more than what you need. if you take 3 and all this, I'm sure that some of them will go back and go and sell to people. Take what you need. Be your brother's keeper. Make sure that you are taking what you want to eat and let other people come for this. But I believe that they should use the community leaders to do this thing. They know how to do these things and do it better. Because if you go to funerals, the same thing sometimes happens. But if there's somebody there who is doing it, that the food is there, you come, you don't even give it to the person, you put it on the table, everybody comes, say, pick one, there you go.
Right.
You pick one and there you go.
Right.
You pick one, say the next batch.
There should definitely be a way by which it can be properly done in a much organized manner. Dr. Mosi, what do you say about what you have just seen?
Well, I think I can only join in the condemnation of the approach. I think Dr. Isasari, who is a government official, has been very emphatic that he does not endorse this. I don't think anybody will. But it's also important not to miss what is important here, and which is the approach of being able to provide for those who are in need in this time. It is my hope that those who really need it are getting it, people are not taking advantage. I think these kinds of interventions are very, very important, very critical, must be maintained, must never be politicized, and ultimately must be done the right way. So I think it's very clear to everyone that we need to do better in this area.
So as we try to wrap up this segment, Dr. John Amosi, again, I'd like to find out from you, as we have just learned yesterday and today. Thankfully, Boris Johnson is out of the ICU. We saw him being driven on a stretcher from the ICU to another ward. As we understand, our commissioner, High Commissioner in the UK, Papa Usa Nkuma, is also being tested, and presently he's on a ventilator. I'm coming to the question of ventilators. This is a respiratory disease, particularly people with underlying, issues. Respiratory issues, diabetes, we are told, hypertension, we are told. An infection becomes more of, a flame to ignite their circumstances and get them worse off. What do you make of our ventilator situation in Ghana?
Samson, this is a question that certainly touches a raw nerve, because it is clear that our capacity for ventilators here in Ghana is severely limited. Not only our capacity in terms of the numbers that we have, but also the manpower to be able to operate them. That being said, I can tell you we are definitely better off than several other African countries when it comes to ventilators. Let me just point out something. When you talk about underlying conditions, we do not know just yet how this virus interacts with underlying diseases, particularly chronic diseases like diabetes, hypertension, and others. Because we've seen other people who have these underlying diseases who have come out, unscathed. I mean, Harvey Weinstein, who was at Rikers Prison in New York, has hypertension and diabetes, has other heart issues, actually had a heart surgery before he went into prison. He's recovered from coronavirus. We know people who have had even transplants, so technically they are immunosuppressed. They have been on immunosuppressive drugs, and they have come out unscathed. So we still don't know how this really works, although we know that those who are dying are those who are elderly and who have underlying conditions. So speaking about ventilators, these are machines that are very expensive. From my last checks, average about 8,000 or so euros or US dollars a piece. All right. Places like the UK, the US, and others are struggling to build for themselves. We do not build ventilators in this country. So what I would suggest we can do immediately is to begin to look at our supply of just oxygen, all right? Because the first step will be to put somebody on oxygen, and then if they cannot breathe by themselves, you will sedate them, you will intubate them, that's you put a tube into deep into their lungs, and then you would make them breathe. You do the breathing for them while they are unconscious. All right. So what we can do is to ramp up our oxygen supply. We have the plants in Ghana. We know how to produce oxygen in Ghana. We just need to get more cylinders, ramp up production. We need to also get the breathing tubes and then the breathing masks. Now, I was just telling a colleague that I think we can make these in Ghana easily. We have the capacity to manufacture these masks. Okay. Technically, even if you look at the flexible tubes that are used by the plumbers, you can use these very easily to construct some tubes for breathing, right? So for now, I would say let's not put pressure on anyone to get in respirators because they're not going to be available anytime soon. What we can do is let's put into working condition what we have available. Let's ramp up oxygen supply, ramp up our production of masks for oxygen supply and tubes. This we can do in country, and just hope that we can do the best of what we have.
Dr. Nsiah, the ventilators issue, how is it central to what we are doing? And once again, I was listening to Dr. Fauci, Anthony Fauci, who has advised as many as 6, United States presidents on infectious disease, and he says corona, the COVID-19, is more dangerous than influenza because of the mode of infection, droplet and even aerosol. We have history to guide us that in 1918, 1919, we are told of the influenza that killed as many as over 100,000 Ghanaians. Like they say, those who do not remember the past are condemned to repeat it. Ventilators define life in this disease. What is our situation?
Yeah, thank you very much. The Ministry of Health has done a census of all the ventilators that we have in this country. But something, it's not only ventilators, it's intensive care units. If we talk about only ventilators, not every one of them will go on ventilator. I'll digress more and then give you the phases of the disease. For the first 1 week, this the novel coronavirus causes what we call it's an infection phase. That's for the first 7 to 8 days. That's where the patient will then have all the signs and symptoms. Then after 7 days, they've realized from what the studies done in China and other places that there's what we call the inflammatory phase. An inflammatory phase means that the virus then attack all the linings of the alveolar and the lungs. And they have a lot of macrophages and activation of macrophages and also some biomedical things released into the alveolar and then destroys the linings of the lungs. And that's where there will be infiltration and a lot of fluid will come into the lungs, and then we need a ventilator. It is said that if you take 5 people who go on the ventilator, about one of them, only a very few of them survive. So you don't have to reach the stage that you need even a ventilator. And because of that, Roche, if you have to mention it, the Roche uses some medicine which is called Atemra, or what you call tocilizumab, which they use to treat rheumatoid arthritis. And that medicine then also is an anti-inflammatory, which will then stop the inflammatory phase. So they've realized that if you give that in China to people who are so early enough, they don't go into the inflammatory phase and they don't need ventilators. Professor Pranju, my very good friend and my brother who died, we realized that we wanted to give a dose of that drug to him. And we don't have it in Ghana. It's not even registered. We quickly have to register it. And we went looking for it. The only place you could get the dose for him is either at Kenya or from South Africa. But good enough, when we approached the president, we used the presidential jet within a matter of about 24 hours to go and bring the drug. Unfortunately, the time it reached here, my good friend was off. So that's what the president did. It went to Kenya. We brought the drug to the country. I went and picked it at 8 p.m. At 7 a.m. in the morning, I was told, my brother, my good friend is gone. So that is how you see the president is looking at it. He saying, no, let's use the presidential jet and bring it. So if you get these drugs, which we are getting about some vials and keep and then we can then give to people who is likely to go into this phase. Then they may not need ventilator. But as much as possible, when the ministry also did the study on the ventilators, we realized we had about 75 ventilators in the system. The ministry has brought in about 25. We are buying more to put in the system. The president has also said that this has brought out that we should have a robust public health system. Ideally, every hospital, every regional hospital, every teaching hospital should have an intensive care unit, not only ventilator, an intensive care unit where patients can be treated, not only for coronavirus, but other diseases. And this is what we are working towards. And then ideally, of the public, of the private sector and all these people and the government, we should also have infectious disease, build standalone infectious disease centers in the 3 ecological zones. Apart from this, you see, if you realize, there's also CSM in the northern part of the country. CSM comes also in cyclical every 3 or 4 years. Then we have cholera. So we should have all these things done. In epidemics, we always say that epidemics and pandemic, no country, nobody gets fully prepared for epidemic. Everybody is late, including the big countries. So I would say that yes, Ghana, we may also have been a bit late. We should have developed all these systems early enough, even in a smaller scale. Right. But fortunately or unfortunately, we have some few ICUs, which is not big enough. Kolibo has some ICU beds. The Rage has an ICU, but the new hospitals, we insist that there should be ICU beds where there will be ventilator. But as Dr. Amosi said, the most important thing is oxygen. Okay. Oxygen. If you have oxygen, you don't even have the ventilator. You can put oxygen on the patient, but the most important thing when the patient gets into the inflammatory space is to take over the respiration. In fact, in some cases, they do the extracorporeal pulmonary resuscitation, where they take everything out and then help the patient to breathe. But we don't want to reach that stage. And luckily for us, so far the patients the positive cases that we have, most of them are not in that critical or serious stages.
Okay. Yes, those will be your final words as we make way for the next set of guests to come in to interrogate the measures so far and how we look to getting and easing up.
You see, Samson, what Dr. Isiasa said is very important. But I hope that as a country we are listening and learning. We at the Ghana Medical Association we've made this call for the creation of infectious disease centers in the country. The last major call was this year, but prior to that, when we had Ebola some 3 or 4 years back, we made that same call. And as our usual approach to life, the country did not really do what we had to do. I'm hoping that we are all learning from what is happening now. The good thing is, for now, we don't have a lot of cases that demand the use of ICU. Okay. But it is also because our numbers now comparatively are small. God forbid, if we should run the kind of numbers that other countries are running now, then we'll all be exposed. So investment into the public health sector or the health sector generally, we have to relook at this as a country.
The fact is that if we have 300 people who need to be on ventilators, we can't take care of
that is the truth as it stands now. Even the human resource who can run that set of activity, the ICUs we are talking about, or what we call the ADU, the high dependency unit, we haven't even trained enough manpower to do those things, because most of the hospitals don't even have them as of now. And these are critical areas that we need to pay attention to.
Yes, I said we are closing now, but can you tell us any information about my good friend, Dr. Ms. Papa Usam in the United Kingdom? How far is he doing?
What I know, he's doing well. He was in intensive care unit and he's doing well. We are all praying for him.
All right.
That's what I know. But something what I would say is,
and it's good to also note the effort the president made in regard to Dr. Rule.
Is leading this fight to the end, and everybody has to help him. It was just said, "Doc, let's use the presidential."
You wanted to say something?
What I will say is that I will conclude by saying that we should all adhere to the washing of hands with soap and water. We should also try to isolate ourselves and distance ourselves from each other, and keep our immune systems very right by eating balanced diet, having good rest, and also making sure that we have at the end of it all we also have good updates from well-resourced centers, not from social media. Go to the WHO website, Ghana Health Service website, you get the important information. And I will end by saying that at the end of it all, it's a duty of me and you to make sure that this disease doesn't go far. And then we should continue praying to the Almighty God. That where science fails, God will help us to achieve.
Thank you so very much, Dr. Anthony Nsiah-Sarrey, Presidential Advisor on Health. Dr. Justice Yakson, General Secretary, Ghana Medical Association. He's also a lawyer. And on Skype, we have Dr. John Amwesi. He's lecturer, Global Health Department, School of Public Health, KNUST, and leader, Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine, KCCR, the Noguchi, if you like, in the southern sector of the country. Gentlemen, I'd like to say thank you so very much for helping this country, and to Dr. Anthony Nsiah-Sarrey and your team helping to, help the president to get a focus and to help us navigate these difficult times. Thank you very much.
Thank you, Samson.
Thank you, Samson.